Hello, Amy Schaus here with NorCal Integrative Medicine. We're up here in Northern California, NorCal, San Rafael, California. Hey, let's talk proton pump inhibitors. Proton pump inhibitors are a very popular heartburn medication. Many people are taking proton pump inhibitors. Examples of proton pump inhibitors are like Prilosec. That's kind of one of the main ones. There's what's the purple pill? What's the name of that? Shoot, I don't want to misspeak. The purple pill, Nexium. So many people are taking proton pump inhibitors. I was personally prescribed these by a GI physician and an ENT when they all were discovering that I had silent reflux. I never took them. Many Americans are taking these, and they take them because they do help many people. There's a subset of reflux patients that it does not help. I was one of them, and there are many it does not help. For most people that pop the purple pill, it does help the heartburn though. But there's a new study that came out, and this has kind of been gradually happening in the past year or two, where there's studies coming out showing that they actually have a lot of risk. So they're finding there's a new one here in Washington University School of Medicine in St. Louis. Heartburn drugs linked to fatal heart and kidney disease and stomach cancer. So prolonged use of PPIs, purple pills, they're saying has been associated with an increased risk of premature death. However, little has been known about the specific causes of death attributed to the drugs. Now, a study by researchers at Washington University School of Medicine in St. Louis and Veterans Affairs St. Louis healthcare system has linked long-term use of such drugs to fatal cases of cardiovascular disease, chronic kidney disease, and upper GI cancer. Proton pump inhibitors reduce stomach acid to negligible amounts, so you're not able to unfold proteins appropriately. You're not able to absorb nutrients like you would normally, and they also help along bacterial overgrowth in the gut, because you need stomach acid to control bacterial overgrowth. Hence, one of the side effects of taking PPIs long term is actually respiratory infections, because weirdly, stomach acid, as it controls that bacteria in the gut, helps also prevent that bacteria from going to your lungs. So just wanted to talk about that real quick. Many people are taking these drugs. There are solutions to heartburn, even chronic heartburn. I had chronic heartburn 24/7 for a couple of years, and I was at my wit's end. I did try PPIs in moments where I felt desperate. They never worked for me, but I eventually found natural solutions. I even had surgery, the gold standard surgery for heartburn, by one of the best surgeons in the United States, but that did not work for me. But there are natural methods. There are ways to end your proton pump inhibitor use. You can do it in several different ways. You want to consult with a knowledgeable physician who understands how to wean you off and understands the underlying pharmacology of PPIs. So I just wanted to bring that topic up today, and hopefully it was of interest to you, or you might know someone, or you yourself uses them. So you might want to look into figuring that out. Thank you for listening.